it's too relaxing, you probably will fall asleep if you're in that sort of space. So just kind of be careful if that happens. Just post in chat if you remember and you wake up and you realize you fell asleep. You're not going to be in trouble if that happens, right? We don't put you on a hit list or anything if that happens. It's just I'd like you to post if that happened to just kind of remind people that yes, you can get that comfortable. You can you can fall asleep during practice. If you're sitting, just try to make sure your hips are above your knees so you're not really slouching, right? If you tend to slouch and kind of pivot and shift and kind of course correct your body a lot of the time, oftentimes it's because you're slouching, right? That's why you're trying to reorient, reset yourself. And one way you can kind of imagine this is that if you had a sort of orb or a ball on your thighs, it should be able to kind of roll down towards your knees. It shouldn't be able to kind of rest on your thighs in sort of a flat way. If you would imagine it and it appears to kind of be flat, then your knees are kind of level. Also, you can kind of tuck in your lower back if that helps. But if you have any like back issues, don't strain yourself. Additionally, because this is a deep breathing practice, um, don't be pushing your breath supremely hard, right? Don't try to go for like 110%. Go deeper than what your normal is, right? So if that's like 20% more than your regular breathing, okay. If that's 30%, that's fine. Don't push yourself. This isn't a lung straining practice. This should in no way be straining at all. This should kind of be in the other direction. This should be completely chill, completely relaxed. And once you've found your posture, I'd like you to just close your eyes here, just for a brief moment, to kind of just settle down. And now just begin to breathe normally here. This isn't the main practice. We're just going to do a sort of light practice to kind of just settle ourselves down here. So as you're just breathing normally, just imagine for this little breather of practice, we're just going to imagine that the breath can travel anywhere in the body wherever you kind of rest your attention. And very briefly here, just check in on your body. How do you feel right now? Is there anything that's catching your attention? Are you stressed about something? Are you in any sort of physical discomfort? Is there a lot of chattering going on in your noggin? Whatever's kind of going on, you don't have to look too deeply for this. Anything you feel that, is leaving an immediate impression on you that sort of can have a sort of hold on your attention here. Just rest your attention in the space where you feel that. And now just begin to breathe as if you're breathing into that space. So if you feel you have a lot of mental chatter going on, just imagine where you feel it, which is typically in the head, and just breathe into that space. If you have physical discomfort, the same sort of thing, right? Wherever you kind of feel that. Our intention in doing this is to just loosen up whatever this feeling is that may have a grip on us in experience. We're not trying to get rid of it. We're not trying to throw it away. We're not trying to, make it disappear. We're just trying to loosen up whatever this is, so it's not too sticky for us, so it's not too grippy for us, with the intention of being more spacious and open for the practice we're going to get into in a couple moments here. Additionally, if you feel that what you're breathing into is pushing back, it's a bit resistant, it's a bit, prickly, take the time now to just breathe a little more deeply than your normal breath. Again, with more of the intention of just loosening up whatever's going on with you right now. So just do this for a couple moments. Very good. Wonderful, wonderful, wonderful. So we'll get into the sort of main practice here. So rest one hand on your stomach and one hand on your chest. It doesn't matter which hand is where. It doesn't matter if you want to place your hand on your breast and instead of like the center part of your chest. If you want to put your hand over your belly button or just above, just rest them in the general area. Okay. And what we're going to be doing here is we're just going to be doing a deep breathing practice through the nostrils. So we're not going to be doing this through the mouth. If you have significant issues with breathing through the nose for one reason or another, you can do it with the mouth, but if you can, do try to do it through the nose here. Okay? So what I want everyone to do now is just inhale slowly through the nose. Feel your stomach rise. That's one of the reasons you have your hand there. When you feel you've gotten a full breath or enough of a breath, just kind of hold still, hold your breath, and now just breathe out. Just feeling your stomach fall. Just breathe out very slowly. This is a slow inhalation exhalation practice. This isn't a fast one. We'll begin again here. So breathe in very slowly, feeling the stomach rise. When you feel you've gotten a full breath, just hold it. And now just breathe out slowly. We'll begin again here. So breathe in very slowly, just deeper than whatever your normal breath is. And hold it. Now begin to breathe out. Once again, now begin to breathe in again. Breathing in slowly, not trying to force the breath. Just taking it in very easy. Hold it. Now slowly breathe out. If you feel you're able to completely exhale before I begin again, you're allowed to breathe normally again. It's just when we begin the rhythm, that's what I'm asking you to breathe in deeply. So if you notice there's a gap between us doing the practice, you're allowed to breathe there. Begin again here. So breathe in, feeling your stomach expand outwards. Now hold it. And now breathe out. Exhale very slowly, very gently. Once you're kind of done with that, you can go back to breathing normally here. Begin again in a couple moments. Okay. Once again, breathe in, feeling your stomach raise. Hold it. And now breathe out. And now for a couple of minutes here, I want you to try doing this on your own. So one way you can do this is when you breathe in normally and you feel you've gotten a full breath, just hold the breath and count to 3, and then exhale. And then once you've kind of done that exhalation, if you've noticed I've left gaps here, just go back to your normal rate of breathing and then just maybe count to like the number 5 once you go through 5 full rotations. And use that as a way of beginning again here. So now try to do this for a couple of minutes on your own here. And I'll come in kind of for the last chunk. Got everyone again. Continue doing this on your own for just another minute or so. And I'll come back in and guide us for the remainder of practice. Alright, I'll continue guiding us here. So if you got a little lost and distracted, that's okay. Maybe more of my direction will help you for the time being. So begin to just breathe slowly, breathe deeply, letting your stomach kind of expand outwards. When you feel you've gotten a full breath, just hold it. And now breathe out. We'll begin again here. Breathe in. Hold it. And now breathe out. Begin again here. Breathe in. Feeling your stomach expand. Hold it. Breathe out. Once again, breathe in. Hold it. Breathe out. Once again, breathe in. Hold it. Breathe out. Once again, if you feel you've completely exhaled, you're allowed to go back to your normal breathing until I guide us again. In case some of you are just wondering why we're waiting. We want to go back to our normal breath before we begin again because it's the act of breathing deeply that helps release all the stress we're having. Once again, breathe in. Hold it. Breathe out. Once again, breathe in. Hold it. Breathe out. Once again, breathe in. Hold it. Breathe out. We'll do 3 more of these. So, once again, breathe in. Hold it. Breathe out. Once again, breathe in. Hold it. Breathe out. Last time here. Breathe in. Hold it. Breathe out. Continue to just sit here with your eyes closed. You can put your hands in your lap if you want to just sit here with your eyes still closed, just seeing how you feel. Just checking on the body here. Do you feel a little more relaxed, a little more opened up, a little more eased? Just kind of sit with that feeling for a couple moments here. That will conclude the practice component of what we're doing today. You can sit here a little bit longer if you want to just be a little more cozy with how you feel. There's no deadline to stop. When you feel you've had your fill and you're ready to open your eyes and stretch and kind of recenter yourself where you physically are, feel free to do that when you feel comfortable and ready to do so. Now we can talk a bit about people's experiences with this, any questions